Today we're going to talk about endometriosis. This is a diagnosis that, according to statistics today, it affects maybe 10 to 15% of women. And the amount of people that are suffering from infertility, 50% of those folks are actually related to endometriosis. And I would argue that this might even be on the lower side because I see this diagnosis more and more often in my clinic. So we're going to address it because it's important to address it. It is an important and it is a relevant part of our life as women. And we want to discuss A, what is it? What is the pathomechanism in regards to biomedicine and allopathic medicine? B, we're going to talk about what are those symptoms, if there are any symptoms even. And so you can recognize in yourself or maybe diagnose and then get some help. 3, what are the treatments for it in regards to biomedically? How can you diagnose it in regards to biomedical medicine? And then finally, what do we do? What can we do? Let's take hold of our health care and see what we proactively can do to reduce the symptoms and even possibly undo some of the damage that might be done. And here's the good news. Many women that are suffering with endometriosis can help themselves. They can reduce their pain. They can increase their fertility. And we're going to talk about it today. Right off the bat, we're going to talk about the pathomechanism of endometriosis. Exactly what is it and what is going on in our bodies? So basically what it is endometriosis is the endometrium, which is the lining inside of your uterus, basically over-proliferating, overworking, overdoing. And it's happening sometimes in the uterus, but oftentimes it will progress to outside of the uterus, to the point so where it actually starts to adhere to other structures in our lower abdomen, including our fallopian tubes, our ovaries, our bowels, our anus, anywhere in the lower abdomen and structures there. And what happens with the hormones is that it's caused by a hormone deregulation. Some may say that this is something that was a family predisposition. I would argue to say that this toxicity and this hormone deregulation that has been prevalent in our community and has not started just recently, but it's been something that has increased over decades. And those toxins are passed down from utero to baby and to the child's child within the ovaries. So it's important to recognize that, yes, do I have family history of fibroids? Did my mom have her uterus removed? Oh, yeah, she did. Well, why did she have it removed? Let's ask questions. Was she just having uterine bleeding that wouldn't stop? Did she have fibroids? And back then, they didn't really have a lot of this awareness or diagnosis, and they didn't have much treatment, so oftentimes they would remove everything. So those are some red flags for sure. And then we will talk about, from an East Asian medicine practice, what we're looking at is what we call yang deficiency, kidney yang deficiency, which is the ability to warm the body. It is the active part of the body, and it's related to blood stagnation, which then is what we feel when we have clots in our menstrual cycle, when we have pain, that's like a blood stagnation, it's not moving, and a liver qi stagnation, which relates to either emotional distress, but oftentimes relates to the actual organ itself being blocked or, stuck, stagnant, and we have to address all of those things. So that's the pathomechanism of what's actually occurring. But what are you feeling? What are the symptoms of this? Could this be you? The symptoms that are traditionally related to endometriosis is, number one, that you have pain during sexual intercourse. Now, this is not necessarily meaning that everyone who has discomfort during sexual intercourse has endometriosis because, for all we know, you might have a tilted uterus, you might just be in the wrong position, okay? And that could cause discomfort. But that is a main component that relates in addition to painful menstrual cycles. And we're talking about very sharp pains, pain before your cycle, pain during your cycle, usually large clots also with your menstrual cycle. We're talking about dark blood, clotted, purplish, dark red, That's not the normal flow. I think I've spoken to in the past about what our flow should be. It shouldn't have any discomfort, really. If everything is really in balance, as close to who as possible, there shouldn't be any pain before, during, or after your menstrual cycle. It should be regular at around anywhere between 28, 32 days. It can fluctuate and relates to stress, where it could be shorter by a few days or longer by a few days. But that is kind of the regular menstrual cycle, and it would bleed for 4 to 5 days, and it would be a medium flow. We're not changing tampons and pads multiple times an hour. It's just a normal flow, average flow, red bleeding, not too much pain, not any clots. So if you're having that, then that means something's not going so smoothly. Something's wrong. Something's related to either pain, hormone deregulation, or some sort of stress, and we have to look at that. But also with the symptoms that people don't always recognize is that you might also have infertility eventually. Let's just say that you are having a regular cycle, but now you're not able to conceive. And you've been trying for 6 months to a year, and you have not been using any contraception, and you're still not pregnant. With East Asian medicine, there's more symptoms that kind of give us a little heads up. That yin-yang deficiency would show as very, very cold feet, feet that you can't warm. They're always cold. You know this. Your hands are not so bad, but your feet are cold, and they just can't warm up. You will have back pain with this. Oftentimes, keep in mind that adhering to the different parts of the lower abdomen could affect your lower back and your bowels. So you'll have constipation. And this is so important. We don't recognize that there is a relationship to our menstrual cycle and our symptoms. I repeat this. I don't think that people check in with women in regards to what's happening with their cycle and how that might relate to what's happening in their body physically regarding pain, like headaches or migraines, or pain even in their lower back. If you're constantly having pain around your menstrual cycle and around your ovulation, one or the other, and that happens every month, then there's something hormonally off. And with endometriosis, this could be adhering to your bowels. It could also be adhering to the L4, L5, the sacral foramen in there, because those nerve bundles innervate not only your bowels, but your uterus and all of those organs. And if there is any kind of blockage there, you're going to have inflammation and pain, and that's going to relate to lower back pain that might even radiate down the leg, where people are thinking, wow, I must have done something wrong at the gym. Oh, something is off. I've hurt myself. But they're not really recognizing that, oh, it kind of comes and goes. Or maybe they do realize that it comes and goes, but they've just accepted they don't know why. But it's actually related to their hormones, and it's related to their cycle. So those are very important things to pay attention to as symptoms as well in relationship to painful menstrual cycle, heavy bleeding, dark bleeding, constipation, pain during sexual intercourse, and perhaps difficulty getting pregnant. Or you are getting pregnant and then you're having early miscarriages, and this has happened multiple times. So those are symptoms, but let us also remember that there are stages to this, and there is actually a stage of endometriosis that is related to people not having any of those symptoms, and that's the one we want to be careful of. And this is where I think people are underdiagnosed with endometriosis. I have had several patients come to me, and they don't complain of pain during their menstrual cycle, really. They have a regular cycle, and the only thing that they're experiencing is that A, they're not getting pregnant, or B, they're having recurrent miscarriages. So how do we diagnose this? Because this is what I would call silent endometriosis, and you're not having any of those other symptoms. So the way to diagnose endometriosis traditionally is, first, you could go to your OB and you could get a vaginal ultrasound. And if they're very good and if they're seeing something that looks off, they might find something that they would then refer out to do a laparoscopy. The laparoscopy is sort of the go-to at the moment, where you go with a small incision to the lower abdomen and they scope the lower abdomen, and they do find any adhesions that might be attaching to, like I said, the fallopian tube, the ovaries, the bowels, etc. And that is where you would get that diagnosis if you have a later stage 3, 4, where it has gone outside of the uterus. But how do you diagnose when it's not doing that? And that is the third option, which is a receptiva test, which is a biopsy of the lining of the endometrium, where they actually can look under a microscope and kind of locate and notice that endometriosis diagnosis through the cellular function within the endometrium. Those are the best ways to know. So what do we do about this and how do we treat it? Is when you get diagnosed now, I feel that many people think it's like a death sentence and it's very upsetting, or they're very confused, and what do I do? So in biomedical medicine, if there's anything that is outside of the uterus, there will be procedures done to remove it. It's very difficult to do it any other way. He gives you a baseline to kind of reboot and restart. It's treating the branch, but not the root per se. So then at the root, we need to address the underlying blood stasis, the progesterone estrogen imbalance, and then the autoimmune component. So that's what that silent endometriosis that I was speaking of, where you find it within the receptiva test, is what happens is that really not a whole lot is showing, other than the fact that once the embryo implants, the body attacks it like it is a foreign object. And that is a component of endometriosis, and that's that autoimmune component that has to be addressed. First of all, I just want to let everyone know at this point, it seems like a lot of information. It seems pretty overwhelming, and I concur and I understand. But just understand that I'm here to tell you that it's not necessarily a death sentence. People do get fertile and heal, and they can help with their pain. And how do they do that? So from my perspective as an East Asian medicine provider, I recommend that people come to us before they try any interventions of hormone therapy, i.e. IUIs and IVFs, and even hormone replacement therapy and menopause replacement therapy later in life, because you'd be surprised what we can do with acupuncture and herbs and diet and supplements. And it's not invasive. It will take a little bit of time, but the essence of it all in East Asian medicine is if you get right and you get balanced, then everything else falls into place. And I really do believe that. So coming into an East Asian medical provider like myself, I would recommend that you find someone who specializes in women's health and fertility. And even more so, someone who really specializes in endometriosis. And I would make sure to find a provider who has custom herbs that you can customize the formula specifically. I find that this is extremely useful in balancing the hormonal imbalance that comes along with endometriosis. So what can you do? You come into our practice. I recommend that you spend at least 6 months to a year just doing what we can on our end, which first and foremost would be a metabolic cleanse. All these environmental toxins are huge contributing factors to endometriosis. They compound on themselves. And the exogenous xenoestrogens, the xenoestrogens that I speak of, they can sometimes take decades for our bodies to metabolize. And that backs up over time. So that includes any foods that are preserved, foods that have genetically modified, foods that have pesticides, products in our bathrooms, or on our skin, in our hair, in our makeup. You can go to Environmental Working Group. It's a fantastic site. It's been around for decades, and it talks all about the environmental factors, such as what's in our air, what's in our water, in our local areas, as well as the products and how we can find other products to replace those products that can help not disrupt your hormone balance. And so that's the beginning. And we do a metabolic cleanse, which anyone who lives or works in an environment that is extremely toxic, for example, environmental factors that are in hospitals, nurses and doctors I see often because they're around bleach and these cleaning products and all these sterile products that are xenoestrogens. They definitely interfere with our hormones. So doing a metabolic cleanse that involves more than just an herb that you just sort of throw in your tea. This is a systemic weeks of cleansing and a multi-phased cleanse that comes with supplements and your diet changes. And we are basically trying to get those fat-soluble, fat-attached environmental toxins metabolized into something water soluble so that we can get them out of the body. And we need to make sure our liver and our kidney and our bladder are working at best through that transition. Because when we're going through adolescence, menopause, pregnancy, postpartum, all these hormonal shifts, our liver, kidneys, they just have to be at tip-top shape. They got to be working at best. And if we have all of these environmental factors that have basically clogged up the works, it's not going to go so well. And we're going to have side effects. And we are not going to have optimum performance. So that's the first thing. Then we're doing acupuncture, and I'm letting you know now, there is hope. Every person who's come to me with endometriosis, I would say, has been able to have some relief from pain. And that comes from sometimes acupuncture alone. And then if you add the herbs along with that, even better in regards to trying to get us as fertile as possible. The herbs that I'm talking about are specialized, customized formulas that focus on women's health. They've been around for centuries. They are useful for helping with clots so that we don't have blood clots. They are useful for helping us bleeding or not bleeding in case we are spotting or bleeding when we shouldn't be, if we're prolonged bleeding, if we're not moving and our cycle is stuck. It helps with our liver. It helps with kidney function. These are all specific, and I don't want to go into one single herb or that single herb because they work together in formulas to balance that yin-yang balance. Everything is got to be in balance. So we have to kind of always put it in a partnership, usually with one or two other herbs at least. And that would be customized to the person. And just one more thing is the autoimmune component. There are specific herbs for the autoimmune component that affects endometriosis, which makes it very unique as well. So those are the treatments when you come in, and we get you going in that fashion if that's what you want to do. But let's just say you've been going through the treatments, you've changed your lifestyle, you've changed the foods that you've put into your body, you've gone away from the processed foods and the sugars and the alcohols, and you have gone towards the center of the grocery store, and you're getting things that are fresh and straight out of the earth. And you have gotten acupuncture, you've been doing the custom herbs, you feel better and everything's going well, but you're still not pregnant. There are other options as well. That is true. We do have IVF, and I would recommend that over IUI since it's an implantation issue. I would highly recommend that you do your research on your clinics. Make sure you are finding clinics that specialize, or finding a specific medical doctor that specializes in endometriosis because of its sensitivity and its autoimmune reaction. There is a different protocol for endometriosis than the other patient that might be coming in for infertility. And then you will do that treatment, and you can continue with your East Asian medical provider as well in regards to helping support the metabolism of those hormones. When you are getting the exogenous hormones from the doctor, can help you with your side effects, and it helps with relaxing you through the journey. And in the end, once you're pregnant, we support you through that, of course, as well. So in the end, just know that there are so many choices. There is a lot of information. And as I always tell all of my infertility patients, it really is about you getting well, you getting in alignment, you getting in balance, whether it's hormonally, whether it's physically, alignment-wise, emotionally, and you also getting in alignment with your partner. If you have a partner through this journey and process, it's part of that too. And from that comes the byproduct of a baby. And that is the plan. You get well, and we're going to get you well. And when you are in balance, then everything else falls into alignment. Anyway, I do hope that this helps and you found this episode useful and informative. And please pass this along to anyone that you know that might be suffering from endometriosis or maybe is curious about it. For your mother, your daughter, pass it to your partners, because the information is super useful and helpful, because it does take a village and it does affect the whole village. So I hope this is helpful. I look forward to your feedback, and until next time. The information provided in this podcast is for educational and informational purposes only, and it is not intended as medical advice. Always consult with a qualified healthcare professional before making any changes to your health, medical treatment, or medication. The The views expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of any medical institution.